On. Dr. Randeep Guleria, former director, All India Institute of Medical Sciences. Welcome, Dr. Saab. This is Vision India Forum's series of Amrit Kal, which is basically a follow-up to the Amrit Mahotsav series that we started somewhere around the 25th of March itself, when the lockdown was announced. And 12th of March was the time when the Prime Minister on that particular year had announced the Amrit Mahotsav period for India, because India was stepping into the 75 years of independence. So I, along with a few of my friends, including General Dr. V.K. Singh, the Honorable Minister of State, Road Transport and Highways, that point in time, we decided why not utilize the online, opportunity that we have been given now. And we completed a lot of shows around subjects of national importance of varied contexts and topics. Then the monologue was planned for, wherein people like you, greats like you, NEP Kasturi Rangan, Surgical Strike, D.S. Huda, so on and so forth, people who's Harit Prasad Chaurasia on the music front, they came on board. They supported this initiative because it's a repository being created for India, for the world, coming 2047, which is going to be the 100th year of our independence, and a journey which has been marked by huge ups and downs, crests and falls, but nothing more significant, much more pronounced than what we faced from 2020 to literally 21 end. Approximately 2.5 years of unprecedented human crisis of a paramount, unparalleled nature. Somebody calls it a man-made disaster, somebody calls it a natural disaster. But people like you stood guard and helped India sail through this crisis. So this particular journey today, before that, we would also like to know the journey of Dr. Randeep Guleria. I mean, there are thousands of people, but then there has to be something special why you get blessed with such an opportunity. And that is what the people, the professionals of tomorrow need to learn. The medical professionals, especially in India, which is a country which is really in dearth of top-class medical infrastructure and personnel. They need to learn a lot from Dr. Randeep Guleria, because he's somebody who's waded through tough waters, ruffled waters, and finally landed up as being the flag bearer of India's COVID-19 journey towards coming out of this health crisis, which would not have been possible had it not been for the, leadership of Prime Minister Modi, his health ministers, his secretaries, his bureaucrats, lakhs of doctors and nurses who worked with their lives in danger, and they lost their lives also. And Randeep Guleria was seen every day. We all remember Dr. Guleria on the screen coming quite often and explaining to us what is to be done, what is not to be done. Probably few lakhs of lives he might have saved with whatever he might have explained as the medical face of the government during those tough 2 years. Without wasting any further time of this great medical professional, let me hand it over to you, sir. Your journey, suddenly what comes up in 2020, and those 2 years, especially the important learnings of those 2 years, which you would probably want to pass down to the common people today, to the medical fraternity. And then going forward, what are the things that we as Indians should keep in mind, so that even if something like this or of a bigger, medical proportion strikes us again, God forbid, we are better prepared as a nation to handle it right away, face to face, knuckles down. Over to you, Dr. Randeep Guleria ji.
Thank you very much for your kind words. And at the onset, it's indeed a pleasure to be here on your program. You're right that we have really sailed through and done very well as far as the pandemic is concerned. We have been talking of a pandemic even before the pandemic happened. And we were worried about it for many years because of the fact that if we look at this century, the last 23 years, it has been a century of many outbreaks. We had SARS in 2003. We had MERS, coronavirus. We had another pandemic, H1N1 swine flu pandemic in 2009. And we've had outbreaks of Zika, of Ebola, and of various other viral infections over the last 23 years. which was a cause of concern. As a matter of fact, in 2018, I had written an article in one of the Indian journals that 200 years after the Spanish flu pandemic, because 2018 marked the 100 years of the flu pandemic, which was in 1718, that we are still not as prepared as we should be for a pandemic. So we were already looking at what we can do. But I think what we have really done remarkably well is teamwork. India really was able to come out of this because there was a good alignment right from the Honorable Prime Minister to various ministers, to bureaucrats, to scientists, to doctors, right down to the healthcare workers, the ASHA workers, all worked in coordination and as a team. And we were able to provide things, whether it be supporting patient care, whether it be looking at the vaccine program, or whether it be looking at oxygen or hospital beds or COVID care centers. So there was a lot of thought process involved in this. And I think the reason why we did so well as compared to the developed world, many countries in the developed world, was because of the fact that there was a good alignment and commitment. Also, I think we as Indians showed how resilient we can be. I remember when the pandemic started, we were worried about shortage of N95 masks, PPEs. At the All Indian Institute of Medical Sciences, we even did a project of how can we recycle PPEs if there's a shortage of PPEs. How can we, if they're in good condition, how can we wash them and re-sterilize them and pack them so that they can be reused if there is a shortage of PPEs. But the whole country got together. Manufacturers started making masks. They started making personal protection equipment. So many things came up. Even ventilators were made by industry which was not into the medical equipment industry, and therefore there was not never a time where there was shortage or we were not getting masks or PPEs, and we actually had recycled PPEs which we just kept as a backup, but never really required to use them. So it showed to me at least that how resilient and how, I would say, innovative our country is. And therefore, sometimes I used to say that if we are this resilient and innovative in a non-pandemic time, then India will very quickly become a superpower, because the type of work that we did during the pandemic was really tremendous. Look at how we rolled out the vaccines. People said that vaccination in India will take years and it will be difficult to distribute the vaccine. Yet everyone got together and we were able to provide the vaccine to every citizen in a very short period of time, thanks to the government, the commitment of our Honorable Prime Minister that the vaccine has to be there, the commitment of manufacturers, and then the vaccine, the healthcare workers who gave the vaccine, the people who were maintaining the cold chain, and of course the CoWIN platform, which was again made by India and which is now recognized globally as being a very good platform in terms of the data that is there. So I think we have had lots of learning, but the biggest learning has been the capacity that our country has to really rise when there's a crisis and to really do very well in terms of innovation, in terms of finding solutions when we're really stretched. And if we can do that during a non-pandemic time, then I think we can really achieve a lot. I'd also like to say that a lot of healthcare workers, a lot of other staff who were frontline workers, even who were not healthcare workers, came forward and did risk their lives and help patients. And many of them actually lost their lives. And I would really like to say that all of these COVID warriors are something that we must never forget and remember the sacrifice that they made so that many Indians could survive and live in a better India. So I think this is something that we need to really appreciate.
Dr. Sir, we'll also use this opportunity to discuss a few things from the health perspective as far as we as a nation is concerned. Now, COVID is one important one, unforgettable episode, but there have been issues and there are issues which probably when we get this opportunity to talk to people like you, we would definitely be, and this is going to be something which is going to set the tone for a lot of, decisions from a bureaucratic and policy perspective as well. because we have a particular process in which these kind of interactions are being cascaded to the right policy makers and the right thinkers. Now, the next thing that I'd like to know from you is, you talked about vaccine. Let me first complete and get over this COVID thing. Vaccines, I mean, uh, technically, scientifically, is it possible? I mean, March it was announced. India could probably, in China, it was spreading something somewhere around December, January 2019, 20 beginning. The PMO, as far as we from the media is concerned, we were aware that PMO had been briefed about it somewhere around January, February, and there were talks and meetings already happening. Then the Madhya Pradesh elections were also due. So many things were happening at the same time because we are a big country and a very complicated nation. But March finally it got announced, and by September and August we started the vaccination, if I correctly remember. We started the vaccination process probably in 6 months' time from the time the pandemic was announced. So you think vaccines are something which can be, we have, or generally also vaccines can be produced for a disease whose genesis is unknown within 6 months' time? If it is controversial, you may opt to not choose not to answer the question.
No, I don't think it's controversial. First of all, let me really take you back a little bit and explain that how much things have changed. In 2009 and 10, when we had the swine flu pandemic, we were not making our own vaccine. India is the biggest manufacturer of vaccines, but we are making vaccines which are already there. So we are making existing vaccines and manufacturing for the vaccine which are for the immunization program for children and other vaccines as well. But new vaccine research, R&D, we were not doing. And in 2009 and 10, when we had the swine flu pandemic, we were not having our own vaccine. We had to rely on WHO donations for the swine flu vaccine. And by the time we got the vaccines made, the pandemic had already moved on and the cases had come down. So there was a lot of learning at that point in time. This time, I think we did remarkably well. We realized that we have to start early. And very early, as soon as the virus was isolated by the National Institute of Virology, Pune, it was handed over to the industry, Bharat Biotech. At the same time, Serum Institute was collaborating with AstraZeneca and research was going on. And in a very short time, in less than a year, in January of 2021, we rolled out our vaccination, and not only one, we rolled out two vaccines, Covishield and Covaxin. Both were rolled out by the government of India, and we were able to then start vaccinating healthcare workers and frontline workers in the beginning, which helped us because then these workers were protected. And when we had the subsequent waves, we had healthcare workers who were protected and therefore could really provide care to patients. But let's move forward. Not only did we do that, we realized the importance of research in vaccines. And therefore, India started investing, and the government gave money for investment in research for vaccines. And now we are actually spoiled for choice. India has a DNA vaccine, which no other country has. First DNA vaccine was made in India by Cadila. We are also making an mRNA vaccine, which can be kept at room temperature. We have a nasal vaccine, which is available. And then CobraVax, which is basically a vaccine which is for the viral-like particles. So different platforms of vaccines are now possible in our country. And this has led to the government being confident that in the future, they could make a vaccine in less time than before. Some people even say that a vaccine will be available in less than 90 or 100 days for any new infection which happens. So that is the speed and the way science is progressing in our country, that now from what we were, let's say 10 years ago, when we were not doing research in vaccine development, now we have so many platforms available to make new vaccines. And we feel that we have the capacity to make vaccines on just 3 months' time. So I think we are moving rapidly, and I hope that we continue to move in this direction, because this is, as was mentioned by the Prime Minister, not only something for India, but for the whole world, because India has the capacity to produce very large doses. We are the manufacturing hub as far as the pharma industry is concerned. And I think that is where our strength lies.
Dr. Guleria, how does it add up when we compare ourselves with the developed nations? As far as research is concerned, we are nowhere. I mean, almost 130th ranked out of 190 nations from a university data perspective. So with that kind of a backdrop of the data that is there from a Human Development Index and all those perspectives from the United Nations, I mean, how do you think that we can convincingly and conclusively state that we have a prowess, which is probably, the type of prowess that you are talking about doesn't really add up to me as a common man? How do you justify that? We are not a research friendly nation. Yeah, the Prime Minister speaks a lot about innovation, startups, but it's as such in a startup stage.
That's true. So I would say that, like I said in the beginning, what we were able to do during the pandemic is something we don't do in day-to-day India. We were able to make a vaccine so quickly, but when we look at how things are in terms of research, it's something that is not top priority. And we need to have high-end research in our country in terms of looking at not only innovations, but also seeing how we can take it to the next level. And what we lack is funding for research, support for research, but also support for people to become entrepreneurs, to become sort of innovate and take the research to market and be able to develop it into products. A lot of research is done in our country where it is left with just a PhD, a paper being published, but then to convert that into something like a molecule for industry, for the market, is something that is not that good in our country as compared to the West, where there is a lot of support for entrepreneurship, for starting your own, let's say, setup, and thereby developing a company where you can start manufacturing and exporting or producing your products. We have a long way to go in that, and there is what we call a lot of valleys of death, where people who have a product, it could be biomedical engineering, it could be a new molecule in terms of a drug, to really take it to the next level, to the market in India is a big challenge. And I think there is a lot of push by the government to really support startups and develop innovation hubs. But unlike what we see in the West, we still have a long way to go.
When the pandemic struck, the cases in India were not really that high. Probably there are many factors, many issues involved in that. And this is not a discussion today that is centered around what's right and what's wrong, and what happened in hindsight. There's no point discussing that. But the entire discussion has to be futuristic. That is where we have met today with you in mind. Now, from a futuristic perspective, uh, we have something like this COVID which struck us in the world, and till now it is not really very conclusively clear as to what is the genesis of this kind of a disease that happened from. Yes, China is said to be more or less the area or the territory from where it emanated, but going forward, I mean, what are the steps that India should take, or the government? I'm sure you've discussed this with the government many times, and the entire bureaucracy knows about what is to be done, what is not to be done. Could you tell us 5 important things that the government should immediately ramp up? Because we are not really in a very safe zone. It's a 140 crore country. And, today something else happens. And first of all, was it a man-made disaster or was it a natural disaster?
This is a tough question because I don't think even the WHO has an answer to that. It's possibly likely to be a natural virus which has emerged, but it's also possible that this is a virus which leaked out from a lab, and therefore then entered the community. Being a novel virus to which there was no immunity, it spread very rapidly. It had the ability for human to human spread. And from China, then it spread to Europe and then, of course, to all over the world.
There was talk about some kind of immunity that really, gets boosted up as the virus becomes old. Could you throw some light on that kind of, and we Indians are supposed to be more naturally immune because of the kind of pollutions we are exposed to, because of the kind of lifestyles that we lead. We are not very hygienic in terms of our lifestyles. Yeah, I mean, I'm not talking about 500 years back, probably when people used to worship nature. Today, the life is so fast for us. So keeping all that in mind, what is that particular immunity that people said that after some time Indians will anyways get used to it because of that immunity working up and the virus becoming weak? Some technical aspects.
So I think it's important to understand what causes a pandemic. 2 or 3 things are very important. A novel virus, that is a virus to which humans have never been exposed, so we have no immunity against it. Secondly, the fact that this virus is novel but has the ability for good human to human spread. There is another virus which has got a very high fertility, which has also had outbreaks, which is known as bird flu, H5N1. But that does not have the ability, has not developed the ability for human to human spread. And that is why it does not cause a pandemic. So if you have a new virus to which you have no immunity and it can spread rapidly among humans, you will have a pandemic. What happens over a period of time is either through vaccinations or through natural infection, we all get exposed to the virus. We had never been exposed to the virus in the past. Now we get exposed to the virus, we get ill. If the virus is causing more severe illness, some people will die, but others will recover. But during the recovery process, the immune system of the body recognizes this virus as something which is a foreign virus to which they have to develop immunity, and antibodies start forming. And now if you do a sero survey, if you remember, a lot of sero surveys were done. If you were to do a sero survey now, you would find that almost everyone in our country would have antibodies against COVID-19, which was not there when the first sero survey was done, where it was shown that only a small percentage of people had antibodies against COVID-19. So now we have all developed an immunity. As far as Indians are concerned, I think we need more data before we can say that we are more protected than others. But what we really have is, because of recurrent infections, our immune system is always more active. And also we have some exposure to different viruses and other infections, and there's always a little bit of cross immunity, which may give us some protection. So I think that is something that has been said, that Indians may have some protection. People in Southeast Asia may have that. And also the fact that now, after almost more than 3 years, almost all of us have had exposure to this new virus and have developed antibodies. Also, the virus has mutated and over a period of time become less lethal as compared to the Delta variant. Both these factors have now led to COVID becoming like a flu-like illness in most people presenting with fever, cough, shortness of breath, without shortness of breath, fever, cough, headache, body aches, and the classical features of COVID pneumonia that we were seeing in the Delta wave, we occasionally or rarely see. So it has changed both from the virus point of view and from humans or mankind point of view.
People with immunity or young people were not really that much at risk compared to those who were probably a little senior or whose immunity was a little probably weak. So I mean, basically the kind of stigmatization and ostracization that started happening in terms of wearing the masks, making it mandatory. So people with normal immunity also over time also, generally also the common perception was, if you're breathing the air that you breathe out or you exhaled, I mean, is it really going to serve the purpose, or is it going to be, having a negative detrimental effect on your health and a long-term impact? Because even now we see people wearing masks. Some of them have made it a fashion. Some of them have made it a habit, part of their own lifestyle, as Mr. Modi had announced when the initial stages that this is going to be a new way of life. So do you really recommend or patronize the use of masks, as human beings are not supposed to be born with masks?
So we are not supposed to be born with masks, but we are supposed to be living in a natural, good, healthy environment. And a lot of things have changed over the last few decades. One is travel. The world has become a small village. You can travel from one part of the world to the other in a matter of hours. And you can carry a virus with you during the incubation period and spread it to that area. So one is that one can now spread infections which were localized to one continent. Many infections were seen only in Africa for decades. But now, because of travel, people carry that infection from Africa to Europe, to US, and to Asia, and therefore you get these infections. Second is encroachment. We are encroaching upon a lot of the natural environment, and the interaction between animals, birds, and humans is becoming more and more close. And that is why viruses now having the easier ability to jump species and evolve into human viruses. And that's why, like I said, in the last 23 years, we are seeing more and more outbreak. Then there are climate change is also a factor which is playing a role. So these are multiple factors which have occurred over the last, I would say, 2-3 decades of 3-4 decades, which have actually changed the whole scenario and made it more conducive for outbreaks and pandemics to happen. And that is why we need to be more vigilant. We need to develop an active surveillance system where we are able to do a good surveillance for any outbreak or any increased admission. The surveillance can be now more hospital-based, what we call sentinel surveillance. If there's a surge in hospital admissions for a particular viral infection or atypical infection, that should be tested to see are we having a new outbreak. And also we need to really do more research on developing rapid vaccine platforms, new antiviral drugs, so that in case there is an outbreak, we are ready with both drugs, vaccines, and also being able to contain it before it can spread to other parts of the country or outside the country.
COVID has been one learning experience, but India's health infrastructure. Now we move to other part of our discussion. I mean, we are in an abysmal state with when we compare. It's not that anybody is responsible for this specifically. It's a 140 crore country. We are not a, we are a populous country, and the most populous country in the world. So, and it's a new nation, just 75 years old. Yes, there are other nations who have been equally old, but they have progressed very fast. But then the population has been a big differentiating factor. Probably China is a different case altogether. In most issues, they have a different kind of a way of working and lifestyle. Governance is completely different there. And a democratic setup like India, which now has a very stable government of the last 10 years, almost 10 years. And uh, dynamically, things have changed. Technologically, things have changed. We are in a global world. India is a superpower. Economically, we are rising very fast. And we should soon be in the top three, or probably in the top echelon of these superpowers of the world. India is the G20 president for this particular year. But health infrastructure, medical infrastructure, uh, you know, what needs to be done? How can more investment be? How much more investment India needs to really cater to the needs of the people down the line? The people living in the rural areas. We have everything, but it is really not effective. Telemedicine. What else? What all can be done to make India? The Pradhan Mantri launched that Ayushman Bharat scheme, that Modi Care scheme, but then there are states who are playing their own cards. So, with all this in mind, from an infrastructure perspective, first of all, what needs to be done for India in the next 5 years? Supposing the government stays stable in the next election in 2024, then what was the roadmap that you suggest to the government in brief, from an infrastructure perspective, from training perspective, from colleges perspective, from producing more quality doctors perspective?
So I think the government is already doing a lot of discussion on this. My own personal feeling is one that yes, we need to invest more in the health sector. Secondly, we need to really see how we not only produce more doctors, but good quality doctors and doctors who are trained for being doctors for the future. Medicine is changing rapidly. Technology is coming in rapidly. We are having a lot of newer things coming in, artificial intelligence, wearable devices, big data. How do we use all of this and train the doctors for the future so that they are able to use this to provide better care to our patients? So the training curriculum has to really keep evolving as technology and healthcare evolves. We also need to see how we can produce doctors who are able to keep this in their mind, and at the same time develop infrastructure for patient care. One is the education and the human resources. I also feel we need to focus not only on doctors, but on nurses and the paramedical staff. They can be a huge source of support to the healthcare facilities. You can have practicing nurse practitioners, you can have nurses helping doctors in providing support in various areas. And they could also be something that could be used optimally as is done in the West. In the West, a large number of the nurse fraternity is used more productively. And that is something that India can do, whether it be the nursing cadre, the healthcare, other healthcare workers. They can be integrated along with to help the doctors in terms of providing better medical care. Infrastructure needs to be also pushed more, because we need to look at how do we develop infrastructure in remote areas in rural India. But infrastructure has to be more holistic. If you develop an infrastructure in a rural area, but there's no supporting structure for that infrastructure, then many doctors are not willing to go to that area. You may have a hospital in a remote area, but if there is not a supporting school out there, then a doctor who goes there, a young doctor will be reluctant to go there because he has a family and he needs his children to go to school also. So we need to look at a holistic development of infrastructure, which will support the and be there would be an incentive for doctors to go there. At the same time, I think we also need to see how best we can use technology to really provide healthcare in remote areas. You already mentioned telemedicine. It with COVID really showed how it could be used both for non-COVID care and for COVID patients who are on home isolation. If we combine technology with artificial intelligence, with wearable devices, we can really move forward and be able to develop various strategies of really bridging the gap that exists between the doctors shortage and the need for doctors in rural India. You could have wearable devices, you could use artificial intelligence, you take an X-ray, you can use AI to tell you whether the X-ray is normal or abnormal. Patient has a problem, you can get an ECG done and the ECG can be interpreted using AI and one can say what can be done. We have now big data analysis, patients' wearable devices can pick up an event before it happens and you can then alert the hospital that such and such patient's heart rate has gone up, his blood pressure is falling, or his saturation is falling, and he needs to come into hospital. So technology, I think, will also help in a big way. And India is very strong as far as technology is concerned. We just need to see how can we adapt it, adopt it, and use it for the future.
What can we learn from the developed nations like the US and UK, which have the bestest of infrastructure, bestest of medical professionals? And, India has recently been plagued with the biggest, kind of, what do you call, disconnect that has happened between the patients and the doctors is the paucity of trust.
Yes.
With growing unprofessionalism and kind of economics driving the so-called noble professions agenda in most individual cases. Yes, there are cases of huge social bent as far as medical practice is concerned, but generally we all understand it's economics that drives, because there is a huge amount of investment that is needed to, after 25 years of education, everything, fees, medical college and all that. Do you think the government can do something from a subsidizing perspective for the medical education, especially because it is not like an MBA education? You come out of an IIM, you land up with a job in a company, you keep traveling, and it's a great life. But a medical professional's life is almost like that of an IS officer. It looks very rosy from outside, but it's not an easy life. 25 years in the as an SDO, as a DM, going up the ranks. By the time that person reaches the principal secretary, ACS level, at the state level also, it's 25, 30 years of his life gone. So similarly, a doctor, if he has to start practicing and start serving in the rural belt, because that is where most of India stays, most of India, survives. Farmers, agriculture, rural economy is inextricably linked to India's social fabric. Now, if that is the case, what is the way in which you already pointed out nobody would like to go and practice in a village? How do you think 110 crore, 20 crore people can be 100 crore people can be served? If that is the scenario with a pocket few of doctors that are available with us, and most of whom obviously want the bestest of careers, they start their own practices. So how do you think this looks like an impossible scenario for a common man like me?
So it's a big challenge. And I think, unfortunately, what has happened in the last 20, 30 years is medicine has moved from being a service to a business. And we need to see how we can correct that. Unfortunately, it was supposed to be a calling and it was a sector where the doctors were supposed to do it as a service rather than looking at it from a business point of view. But then also there has been 2 or 3 changes which have driven this. One is we have moved from what was clinical medicine. 20, 30 years ago, you went to a doctor, he examined you, he looked at you, and then based on that, started you on treatment. Today, we have moved from that to what we call investigative medicine. You go to a doctor, he'll ask you to get a large number of tests done. Some of them would be expensive, and that adds to the cost of healthcare. So we need to see how can we balance clinical medicine with investigative medicine rather than going down the investigative medicine track, because that obviously adds to the cost. At the same time, also because of the lack of trust, there is also a lot of what we call defensive medicine, which was in US because of litigation, but it started happening in our country, that people would get more tests done just to be on the safe side, even if they knew that these tests are not required and they have a strong feeling that this person does not has this problem, but to have a definite diagnosis, they will get the test. So defensive medicine has also crept into our country. We need to develop a mechanism where medicine becomes more of, let's say, a social responsibility, that the state or the government invests more both in medical education so that people don't have to pay so much in terms of private colleges, and at the same time, a system where it could be insurance based, it could be looking at what the NHS in UK is about, or various other welfare states in Europe are about, that people, irrespective of the socioeconomic status, are provided high quality healthcare, which is supported by the government either through insurance mechanism or as a social structure. We need to go through that path, because in our country, looking at it from a business point of view, or as looking at it as what is the US model, will not really work, because majority of our patients cannot afford the type of cost that healthcare is now having. And this is creating, like you said, a sort of lack of trust and faith as far as the doctors and patients are concerned.
There is this talk about introducing basic medical education in the school levels also. Because you see, when we were kids, I mean, I remember when probably you were a student in a school, the first aid was used to be some kind of a curriculum we had around first aid and all that. Today's schools, they are so much deep into so many things, extracurricular, post-scholastics, and so many things. But medical education, hygiene education, all this is missing out. Do you think even the school education should introduce some basic aspects of medical education, because you need not produce doctors by the time they are 16, 17, but they should have knowledge about basic facts of life from a medical perspective. Do you endorse that particular idea?
Yes, so I think if you look at how India has evolved, we have evolved from a country which had burden of disease was more infection and communicable diseases, maternal mortality, and now the burden of disease, 55 to 60% of disease, is what we call non-communicable diseases. These are cancers, diabetes, hypertension, chronic respiratory disease, chronic kidney disease, heart diseases, and these are all lifestyle related diseases. And we need to therefore work on how can we use preventive health. These are diseases which can be delayed or prevented by our changing our lifestyle. So in firstly, I think there is a need to educate children and schools about the diseases that are there and how they can prevent themselves from getting those diseases. I'll give you one example. We were doing a study long time back, trying to look at children and trying to see for what we call sleep apnea. And we found a disparity. We went to a government school in South Delhi, and we were looking for children who are overweight and obese. And we just found one or two children in that government school. And we were very disappointed. We went to a private school in the neighborhood, and we found almost 300 children who were overweight and obese from coming in the same area. But when we evaluated these children with blood tests, many of them already had features of high sugars, of cholesterol going on the higher side, and various other factors, which suggested that unless we did intervention now and change their lifestyle now, they would later on have a higher chance of developing heart disease, diabetes, and hypertension. So I think it's very important for us to really use teach our children about preventive health. That is the first thing that we need to do. In terms of the lifestyle diseases, we see children are not playing outside; they're more onto their video games or the computer, and a lot of children are eating food which is not healthy. So that I think would really help. Second thing is that there is also a training for what we call basic life support. Very often you have people who collapse because of a heart problem or some other issue on the roadside, and it's the bystander who helps them before the medical help reaches that place. So training students in basic life support will help in CPR, in terms of how to support a person if there is a trauma, if there's a heart attack, or if there's some accident. So they would be able to provide care before the trained healthcare people come. So I think both teaching students about lifestyle related diseases, about pollution and how they can help in bringing down pollution, and also how they can do basic life support is something that we should introduce in schools.
Yeah, that is definitely on, because you see, prevention has always been better than cure, and preemptive approach towards diagnosing any kind of, at least from the fitness perspective, if that can be taken care of right from the school standards, obesity and those kind of issues with kids, because of the stagnant lifestyle, that can obviously have a huge impact on the nation's resources when these people start growing forward and becoming older, because ultimately the healthcare costs would reduce, the impacts would reduce. From a legal perspective, India seems to be very, very immature from protecting both the patients as well as the doctors. There is a lot of violence against doctors nowadays. You can see and keep hearing about cases of violence happening against doctors as well. So what are your suggestions to the judiciary from a health perspective? What are the issues that can be immediately taken up? Because it can't be a banana republic and free for all kind of a situation where hospitals are vandalized, doctors are killed, doctors are mistreating patients, insurance companies not paying back. What are your suggestions?
So this is a big challenge, and I do agree that there is a lot of violence against doctors, which is unfortunate and uncalled for. I strongly believe that doctors themselves do the for all patients. We are at times in the emergency overworked. There are usually a huge number of patients. You have to prioritize and try and see whom you can save, and therefore work on that rather, and who's stable, and sort of manage them a little later. So if you have one doctor looking after, let's say, 20 or 30 patients, you will have to prioritize your patients, and patients have to understand that. But somehow there are emotions run high, and it causes, like you said, violence, and this is something that is unacceptable. We need to develop strategies of how we can de-stress both the patients, attendants, and the doctors, and the judiciary needs to really be firm so that this is not done on a regular basis. At the same time, we need to develop, we are evolving in terms of a lot of things that you mentioned, the insurance system and others, and we need to develop strategies which are sort of practical in our country, and see how best we can use them to help both the patients and the doctors as far as India is concerned.
From a clinical diagnosis perspective, I'm just talking, all these hackneyed questions you've answered probably a lot of times, but some, very, very common questions of day-to-day life for us as Indians. We are technically connected. There is so much of online technology available, but access to the best of doctors, everybody wants a pie of Dr. Randeep Guleria when it comes to a particular, field or discipline of medicine. But Dr. Guleria is one person. Everybody wants the best heart specialist in Delhi. So, I mean, at the same time, the same doctor, if he is attending a particular hospital, he's part of that hospital as the head of the department. He's got a particular care associated. He has to visit 30 patients. He has to, at least cater to 200 OPDs. I mean, I have seen you 20 years back attending to 200 OPDs in AIIMS. Let me disclose that as well. So things have not changed. I'll tell you, Narayana Hridayalaya, the one owned by Devi Shetty ji, Padma Bhushan, Devi Shetty, even the bestest of brands, But yes, when the moment we go to very good places, I'm talking as a common man. If I go to a CMC Vellore, it's a completely different world. How have they managed to maintain systems? They also get a huge influx of patients. The entire city revolves around patient care, right from Bangladesh to Sri Lanka to Nepal to Bhutan, probably Pakistan, I cannot include, but everybody else comes. So how are they able to maintain it, and why can't those systems be replicated across at least the big hospital chains? Even an AIIMS, I'm sorry to say, doctor, but even an AIIMS, when I visit, it's a scary thought, it's a scary sight. But when I visit hospitals in South, it's a completely different world. They seem to be so balanced, seem to be so organized. So what has gone wrong so much in North, and what has gone right so much in South? If you wish, you may answer.
So healthcare is different in different states, and it is a state subject. So in some states there is a good amount of investment. There's more dedication as far as doctors are concerned, and also the system has evolved in that area in a way that it becomes more sort of systematic. Whether it be appointment system, whether it be the system of let's say booking your appointment. You don't wait, you can come after 1 to 2 hours and you can go and have your tea or coffee or breakfast, things like that. Somehow that has not evolved that well in the northern states, and the investment in health also, sad to say, has not been that much. So you can, if you look at the states in the south, in terms of even the rural part of those states, the healthcare facilities are much better than what you would see in certain rural states in the north. So I think because it's a state subject and the priorities of different states have varied, that is what one sees, and there is now a sort of a catching up happening in a lot of states in the north and central India. And I hope that over the next few years, these states will also take the health sector seriously and invest more, and we will probably be able to develop strategies which are better or equivalent to what we see in the south. Of course, there is also the whole challenge of poverty, increasing population in many states, which also leads to stress on the system.
I think, yeah, there was a little connection glitch. Dr. Saab, last 1 minute, and then we'll close the show because you've given us so much time. Thank you. I mean, see, all said and done, it's a human interaction. It's a human issue. Medical profession is completely human issue. And that is where the gap is getting wider and wider as we, are getting more and more competitive, etc., etc. Our lives are becoming more difficult and more complicated. Money is really driving the show. So with that in mind, it's all about compassion. It's all about empathy. What is your view with respect to, communication, empathy, and compassion being an integral, inextricable part of medical education? Because I was talking to AHPI a few days back, my dear friend, very dear friend, Devi Shetty and Alexander Thomas, the DG of AHPI, they were all telling me they have introduced courses with certain hospitals wherein communication is going to be a very important aspect of this particular training of medical fraternity. So, you see, what is your view on communication and empathy being an integral part of our education system now from a medical training perspective?
So although we have made major advances as far as science is concerned, in terms of technology, in terms of new drugs, in terms of vaccines, it's very important for all us to remember that medicine is both a science and an art. So while we talk of the science of medicine, we should not forget the art of medicine. And the art of medicine is as important as the science of medicine today. And the art of medicine involves empathy, being able to understand your patient, picking up things which the patient may not say, but has those signs that he gives you, that when he hesitates, when he talks. So not only communication, but picking up non-communication cues from the patient, which will help you to understand that the anxiety that the patient has. Sometimes you just to relax the patient, because coming to a hospital, a patient feels that maybe he has a very serious disease, maybe he has cancer. So just putting the patient at ease, communicating with the patient, trying to make the patient understand that you are there as to support him, are also things that we need to really train the current doctors. And most colleges have now started, not only for undergraduates, but even for postgraduates, courses on communication skills, on empathy, on interpersonal relationship, and even during COVID and after COVID, also the issues of stress and strain in doctors, mental health issues, which also happen because there is also a lot of burnout which happens in the medical profession. So these are new things which have evolved with time, and one has started that. Initially, all of this, the science and the art of medicine was something which your seniors, your professors taught you while they took bedsides and taught you the manners of how to talk to a patient, how to really interact with the patient, how to have empathy. But over a period of time, that has become less, and therefore I think it's now something that has been introduced as courses in most colleges. AIIMS itself has it's compulsory for all students to do a course on communication skills.
So, Doctor, thank you so much. It was a pleasure interacting with you. I mean, there are many questions, loose ends that need to be taken care of. But this is a very, very tough scenario that the any government in India would find itself in, and there has to be complete synchronization with the center and between the center and the state. If these, issues of health can really be, Doctor, before I end the show, one very important question I had in mind personally also. I have visited a doctor, and then what happens generally, people like us, when we visit doctors, we have an emergency suddenly at 2 o'clock in the night. The doctor is a human being, he's got his own life. I mean, this must be a kind of a perennially pinching problem for both the patient and the doctors. What is the solution that you have with your experience? Could you tell this to the entire doctor fraternity, medical fraternity? I mean, whom should we call? I mean, 2 o'clock in the night.
So most places, the doctors will give you a common number, which could be of the resident on call or the doctor on call, who is there 24/7 by rotation, and you could call him and ask him.
So that's a hospital. That's a hospital. Yeah. But what about an individual consulting doctor?
So individual consulting doctors also are human beings. So it's sometimes it's expected that even if a doctor is on a holiday and he's told you to contact so and so while he's away, the patients will still call you. And I've had situations when I have been down with fever and not well, and patients still insist that I come and see them and will keep calling me on the phone.
Neither is at fault. Neither is at fault. That the patient is really in problem, and the doctor is also a human being. He is also in a problem. Probably he's holidaying. That is his problem. Now, in that, or probably sleeping 3 o'clock in the night. You don't want him to be treated next morning. So what is the panacea for this kind of a situation? We are a 140 crore nation. Probably, is it telemedicine a solution? Can that particular practicing doctor, and that can become a norm for all doctors practicing in this country, because we face this every time we have some issue in the from a health perspective. We are worried. रात को 3 बजे किसको फोन करेंगे? पेट दुखने लग गया, उल्टियां बढ़ गई हैं, अब क्या करें? What to do and whom to talk to?
So like you said, there is a mechanism where you could ring up a hospital. You could have teleconsultation, someone who's available 24/7. It may not be your doctor, but you can have a specialist who you can talk to, who is on call at that point in time. And then in the morning, he can then brief the doctor that you are interacting with, and that the doctor can subsequently sort of take over the case from there. So I think for acute problems, a system needs to be developed where it need not be the doctor who is looking after you, but a doctor on call who is equally competent and is available around the call, and you can around the 24/7 around at all times and by rotation, and you can consult him for your immediate problem, and if there is a need to come to the emergency, he will advise you to come to the emergency. If it's something which you can take some local treatment, or it's something just to reassure you, then that can be done. And at the same time, you will not really cause a problem as far as the doctor is concerned, and the patient can also be taken care of. And during the morning, the doctor who is his personal physician or who's looking after him can then subsequently start taking over the management.
Finally, all said and done, do you think our ministry, as sensitive as health, should be led by somebody who is not a doctor?
This is a tough question. I think anyone who it has to be someone who understands health. It can be a medical person, it can be a non-medical person, and who has a commitment for improving the health sector.
Thank you, sir. It is a diplomatic answer, diplomatically and politically correct. But then, we are a democracy, and then we have to function within the constitution's circumferences, and we have to ensure that as a nation, it's a collective responsibility. No one is individually responsible. We are all collectively responsible. The society is collectively responsible. Doctors do not come from Mars or Venus. They are as human as we are, patients are, and the society as a whole has really changed so much that personally, if somebody may ask me who is to be blamed, and nobody is to be blamed in this particular fiasco or imbroglio that we are in now. It is the entire country, the way we are trying to ape West at the same time, not really taking care of our own roots or going back to our own roots. That is where the entire problem lies. If we start following our own roots, respecting our own culture, tradition, what we used to do 40 years back, 50 years back, 100 years back, probably we will be in a better shape, especially considering that 100 years back we did not have what we have today. So be proud of what we have today. Try and use that more instead of cribbing about what we do not have. That is the only way forward, looking forward in a positive way. Thank you so much, Dr. Guleria. It's been a pleasure, sir. Hats off to you. Thank you, sir.
Thank you very much. Thank you for having me.